I'm Matt Willis, Public Health Officer for Marin, with a COVID-19 message. And today, I want to touch on the good news that physical activity protects against severe COVID-19 outcomes and long COVID. And it's a message I wanted to offer outdoors. The reason this topic is important as we come out of the COVID state of emergency is that it reinforces an important long-term and sustainable measure that we can all take in our everyday lives to protect ourselves, not only against COVID-19, but other diseases, and safeguard our health and longevity. In the past few months, several large studies have been published showing one of the most important protective factors against severe COVID-19 illness is physical activity levels prior to infection. I'm going to describe a recent study of nearly 200,000 adults published in the American Journal of Preventive Medicine, and the design was simple. All patients reported their physical activity levels prior to infection, and each fell into one of 5 categories, ranging from inactive, which was less than 10 minutes of exercise per week, to very active, which was more than 150 minutes of exercise per week. The researchers then followed these people and analyzed their outcomes for subsequent COVID-19 infection. The results showed the more physical activity a patient reported, the lower risk of hospitalization or death within 90 days of COVID-19 diagnosis. What stood out to me is this. This trend was consistent across all activity levels, with the most active patients facing the lowest risk. We call this a linear relationship. More regular exercise, better outcomes, starting at even very small amounts. So the take-home of this giant study was this. Every little bit of physical activity helps. Basically, the more exercise, the better, no matter a person's race, ethnicity, age, sex, or chronic condition. That relationship held true for all of those groups. This research builds on earlier studies that showed similar results, and other studies that are showing the same association seem to hold true for long COVID risk. Meaning that regular exercise itself, even in small amounts, seems to independently protect against both severe COVID outcomes and long COVID. Now, this might seem obvious, but it's remarkable to see how little this has actually been discussed in the national dialogue. And these findings might have particular relevance for us in Marin. We already know that pandemic outcomes in Marin are among the most favorable in the nation with regards to hospitalizations and deaths, despite having among the oldest demographic populations in the state. We really should have had higher death rates than average because we're older on average, but instead we fared much better than most communities. And that's obviously a combination of factors, with the vaccine being the most important. But it's important to note that that pattern started before the vaccine arrived. And if we look at other factors like frequency of physical activity among Marin residents, Marin is an outlier. In fact, other studies have found that Marin residents above age 50 engage in regular exercise more frequently than in almost any other community. As a resident and physician in this community, I see a pattern here. Marin also has among the lowest number of fast food outlets, the lowest smoking rates, and best access to green space. All of this comes together to reinforce what we already know, that healthy bodies and healthy communities are more resistant and resilient to any threat. As a health officer, it's remarkable to me that there's almost no condition or disease that's been studied, literally hundreds and hundreds of studies, where being active doesn't improve outcomes. Some of the most important other threats to health in Marin, breast cancer, depression, substance use, cardiovascular disease, are all very clearly impacted by regular physical activity. Put simply, the human body likes to move. We're fortunate to live in a community that recognizes and supports active living. We're surrounded by opportunities to get out and move, and we're lucky to have a park system that offers access to everyone. One goal, from a public health standpoint, is to make sure that every family, regardless of income or race or any other factor, have the same opportunity for active living, just as we've prioritized equitable access to other life-saving measures like vaccinations. Thank you for doing your part.